Welcome to a special Brain Tumour Awareness Month episode of Neuro Stories, the podcast that highlights the people behind neuroscience at the Walton Centre. In this episode, you can hear from Nikki Bennett, a patient with lived experience of brain tumour, her partner Liam, who's fundraising for the Walton Centre charity, and Professor Michael Jenkinson, who explains the complex nature of brain tumours.
I am Nikki. I am currently awaiting a cranioplasty. I suffered a brain tumour in June 24.
I'm Liam. I'm Nikki's husband. Yeah, I was with Nikki the whole way through her brain tumour.
Nikki, go back to the beginning for me and just tell me about what led you to the Walton Centre.
I had been feeling not 100% myself for quite some time. I put it down to work, and then on a Monday morning I woke up with a headache, but then woke up on the Wednesday and I had a slightly baggy eyelid. Obviously you look online at the NHS website and it came up with temporal arteritis. Went to the doctor. The doctor said he possibly thought it was and sent me to A&E. I was lucky they let me go home. I went back the next day and I saw a couple of doctors. Basically, I had some pain in my jaw. So he said, could it have been something from the dentist? And I was quite adamant it wasn't anything from the dentist. The pain was in my temple. And he decided he was going to do a CT scan. So they did a CT scan and that's when they found the tumour the size of an orange.
My name is Michael Jenkinson. I'm a Professor of Neurosurgery and Surgical Trials here at the Walton Centre in Liverpool, and I also work for the University of Liverpool. Brain tumour, like any tumour, is an abnormal growth of cells. So tumours can appear anywhere in the body. The brain is no exception. So tumours in the brain can arise from within the brain substance itself, or they can arise from the linings that surround the brain. And depending on where they come from, depends on what the name of the tumour is. But in the simplest term, you can think of tumours as being cancerous. So those are generally bad. People generally know what cancer means. And also benign, but probably a better word would be non-cancerous. Benign implies that if you take it out, it's all gone and it's never going to come back and there's no harm from it. In the brain, it's slightly different because you can have benign or non-cancerous tumours, but they're in difficult locations or difficult areas, and the treatments and the problems that those benign tumours can cause can have lifelong impact and lifelong effects. There's a lot of movement from the various brain tumour charities around the country for us to really change the way we talk about things. So instead of benign, using non-cancerous is a better description. Headaches are common. We've all had headaches. Most headaches are spontaneous and settle down on their own, maybe with a paracetamol or a ibuprofen, something like that. If you're not a headachy person and you're suddenly starting to develop headaches, that might be a sign that you should think about things and monitor it. And have to remember, of course, that of all the people who get headaches in the world, it's only a very, very small proportion where that headache will be caused by a brain tumour. So people shouldn't go away thinking that a headache means that you've got a brain tumour. In fact, it's probably the reverse. Just because you've got a headache doesn't mean you've got a brain tumour. Most headaches are not associated with brain tumours. There is this concept of sort of headache plus. So if you've got headache plus other types of symptoms, then that might be a stronger sign that you might need to go and seek help. We did some very nice work with a group of researchers in Cambridge, a group of GPs, and they looked at the symptoms that people with brain tumours had. And very often these symptoms are quite subtle. So in hindsight, when people look back, they just had this feeling that their brain wasn't quite right, in inverted commas. So quite subtle things. And a lot of people attributed those to, oh, I'm just getting older, or my memory's not quite as good. If you've also got headache with those would be symptoms to look for and symptoms that you should discuss with your GP. People know their own body the best. People can see how their body is changing over time, And most of us, as we get older, we see this gradual change over time. It's when you see a more rapid change, that's when you should think, well, this doesn't seem quite right. I shouldn't be feeling like this. And that's when you should seek medical advice.
When it was on the scan, when you saw that, what was your first thought?
I was I just took the information in a very calm manner. I just accepted what they said. I said, okay, a lot. Then we literally got explained everything, and then we got sent out into the other room. It was my stepmom and my son that were with us at the time. We were said we could go and explain it to them, which we did. And then another doctor came through and asked to tell me again, because he didn't think I understood what it was that they were telling me. But I did understand, and I'm a facts-driven person. I needed to, at any point, not panic and just accept what they said and hear the next steps, and then I would take action from there.
So you went into autopilot a little bit to get it done?
Yeah, that's exactly it.
I was a bit more panicky than Nick. Obviously, because we thought it was temporal arteritis. We'd gone in there, we was laughing and joking in the waiting room. My son and myself had just gone and got some tea because we was in there quite a while. And then they literally took us into the room and showed us the CT scan, and I nearly threw up. It was a massive shock to my system. But look at Nick was just sat there, just okay. And I was a bit more flustered than Nick, to be putting it lightly.
It's quite a shocking thing to say, I guess, isn't it? To hear that about yourselves, because you're both, fit and young and healthy. A bit of a bolt from the blue, I guess, Nikki.
Massive. As far as I was concerned, I was fit, I was healthy. I just had a bit of a headache, and that was it. I didn't think it was anything serious. The last thing I think I ever dreamed it would be was a brain tumour. I just thought they'd do the CT scan and that would be it. And my body just went into autopilot. That's the best way to describe it. It just took in the information, knew it needed not to panic, because I know how bad stress and panic can be for the body. And I just needed to act. And that it is a protection thing. I think you just don't panic and just allow them to explain things, and just I knew that I needed to be calm. I was referred to the Walton the following week, ordered more tests and things, and then on the following Tuesday, so it was a Thursday I found out, the following Tuesday, the Dr. Chatterjee, who'd been conducting all the tests, said he would send off a report. So basically we were then at the disposal of the Walton. By 2:00 the next day, I'd had a phone call to say I was in on the Thursday. So there was no time at all to even contemplate anything. I was literally in on the Thursday with Dr. Lawson to find out what it was and what the next steps were.
Yeah, they took over pretty much straight away. She was under oncology at St Asaph, and she was getting referred straight away. So they ordered a full body MRI straight away, more CTs. They just literally took over, but we could do most of the work down here so we didn't have to travel. So it was basically they were in control from day one.
Yeah.
You had your surgery.
Yeah.
What was that whole experience like?
So the actual surgery, when I came in to see Dr. Lawson, he told me I would be in the following Tuesday. So when I went in, I was going down for surgery on the Wednesday, and I'd been prepared that I would more than likely be kept in a coma, left overnight, and the surgery would be, quite lengthy. So when I woke up from the surgery in recovery, bright as a button, I thought, this is brilliant. I was happy. I was in no pain. I was on the phone to Liam from the recovery room and my son, Cameron. I was just shocked how well I did feel. I went back up to the room and I just couldn't get over how amazing I did feel. I had 5 days in hospital, no painkillers. I had no pain, which was it was revolutionary, because I thought that there's bound to be some pain looking at what I'd had done.
It was a big tumour, wasn't it? And there was quite a lot of risk with it being there.
Yeah, a hell of a lot of risk. The way Dr. Lawson put it was, if I had a seizure, then I wouldn't make it. And that's how serious it was from that point. So we literally took life as a gift from that minute onwards, that every minute was just spent trying to get me to the Walton so that they could take the tumour out.
Now that you're sort of a few months away from it, you're waiting for your cranioplasty, which is exciting, but obviously an unusual situation. How are you feeling right now?
I'm very excited to have it done. I think I had a lot of feelings of, I've got even more time to get even fitter now. This is like my benchmarks moved. I need to continue on this journey that I'm on. November, I did some charity fundraising. And then in December was Christmas, so everybody's fine. Then as soon as Christmas was over, I was like, I'm ready. Okay, let's go. Time goes really quickly, and it does when you look backwards. But when you look forwards and you don't have something, it takes a long time to get there.
What's coming up? What are you currently looking at the moment in terms of treatments for brain tumours?
So there's currently a fantastic initiative being driven by the NIHR, that's the National Institute for Health and Care Research. And at the moment there's a consortium being developed across the UK, led by one of my colleagues, Juanita Lopez, who's an oncologist at the Royal Marsden in London, and Darren Hargraves, who's a paediatric oncologist at Great Ormond Street. And this consortium is aiming to bring together a huge number of researchers across the country to try and develop new clinical trials in this area we call precision medicine. So this is patients with brain tumours, looking at their tumour samples, doing all sorts of clever tests and clever genetics on it, and trying to work out if there are specific things in each person's tumour that could be targeted with drug therapies.
Right.
And this is really important because we know, we're pretty much at the limits of what we can do for most brain tumours with surgery. We can either take it all out, we can take most of it out. Sometimes we can only do a biopsy. There's a limit to what you can do in the brain. It's not like the bowel. We can't chop out a big chunk either side of it. We can't do that in the brain. You can only take out the tumour. We're at the limits of what we can do with radiotherapy. That's sort of X-ray treatments. That's been around for hundreds of years. Marie Curie, as we all remember, discovered X-rays. There's a limit about what we can do with that. So if we're going to make discoveries, it's going to come through drug trials, maybe vaccine trials in the future, if we're lucky. So that's the next big thing that's coming down the line. The difficulty with most brain tumours is that they are incredibly complicated. So it's one of the most complicated tumours that there is in the human body. Lots of different genetic mutations or gene mutations within them, lots of different biological pathways that are active. And the challenge is, how do you turn those pathways off? If you've got a clever tumour that you block one route for it to grow, they're quite clever, so they'll just find a different route to go. So it's about trying to find the roadblocks for every single pathway in that tumour that will stop it from growing. And that's the challenge with brain.
And that's what this consortium is aiming to do, gather all the research together to come up with this.
Yeah, and it's trying to develop a series of different studies, looking at different pathways, some of them on their own, some of them will be in combination, and trying to get these trials up and running across the UK so patients can participate and hopefully benefit not just themselves, but patients in the future as well.
And speaking of patients, obviously, they take part in research in a very physical way, but how important is the patient voice in terms of feedback, in terms of research?
Patients are absolutely critical to research. I mean, patients should be driving the questions that we want to answer in research. I mean, we can all, as doctors, as researchers, say, what do we all want? Well, we want better treatments, try and put the tumours into remission. Maybe you can't cure it, but you can achieve longer term control. But ultimately, it's the patient voice at the centre of it that's driving that. That's what they want. Better survival, better quality survival, as well as length of survival.
What's important to remember about brain tumours?
March is Brain Tumour Awareness Month. It's really important to remember that brain tumours are still rare. So not every headache plus other symptoms will mean that you have a brain tumour. However, if you are concerned, if you are concerned about a relative or a friend, then it's important to check out the NHS website, check out the charity websites, seek medical advice if you think that's appropriate. For the majority of people, these symptoms are not going to be due to a brain tumour. So that's a really important take-home message.
My perspective has been perfect. I can't applaud enough the service that the Walton have given me, the nurses, even down to the cafe staff. They're all impeccable in the way they treat you, and you are treated with respect. And I just think that it's something that is not available with your every person on the street. And I love it in there. I do. I knew there was something not right with myself, and that's why I pushed. And I think, your own body, what's not normal for you. People listen to you if you feel like there is something not right, and get them to look. You don't have to have the answer.
So obviously being by Nikki's side this whole time, what's it been like for you?
It's been rough. Yeah, very rough to look back. I said this to you the other day. I said, not in a selfish way, that it was all right for you because you'd never seen any of this, or she doesn't remember anything from the hospital the second time round, and it was us that was there. It was very hard. Yeah.
How does your experience then translate into the year of fundraising that you want to do for the Walton Centre charity?
When Nick went into intensive care, I literally left our home with the clothes I had on, and we drove an hour and a half to the hospital, and that's all I had. I spent the day with her in intensive care, and then she didn't go into theatre until about 12:30, that night. And then I sat in the family room there and waited for her to come out of surgery. And it was a nurse that was in intensive care that said, "We've got you a room here. You can use it as long as you want. It's got showers and stuff like this. It's called a Home from Home. It's a charity-run place for families to come that live far away." And I said, I didn't even know it even existed, but I was so grateful that it was there. From that moment, I just knew that I had to give back, because that gave me somewhere to stay, even if it was just to get a shower or something like that. It gave me time to just sort myself out so I could be in the best possible shape for Nick.
Home from Home is literally across the car park from intensive care and the theatre department. That must have been really helpful.
Unbelievable. I couldn't even imagine trying to drive home. It just to be able to. The first thing I did when I woke up in the morning was I just went straight to intensive care. I knew I couldn't get in, but I could spot a nurse and just ask, "Is she okay? Has she been good through the night?" Stuff like that. Like you said, you're literally across the car park. It is a lifeline for families that live far away.
Because of that, then you've decided to do some fundraising. What are you planning to do?
Planning to run the Ibiza Marathon in April. Ibiza has played a massive part in mine and Nick's life since we got together. It's somewhere we return to every year. I'm running the marathon there on the 12th of April. I then will be cycling from my home in North Wales to the Walton and back over a 24-day period, I think, which is around 3,200 miles. And we came up with this because there's roughly around 3,200 people who are diagnosed with meningiomas in the UK each year. And then to finish off, I'll be taking part in the Ironman in Tenby in September.
I think it's safe to say you're going to be a little bit broken by the end of the year.
Yeah.
Or
a little bit
superhuman.
Let's go with the superhuman.
Yeah, I would say he is going to be superhuman. His mental strength and dedication already is huge. It's huge. I can't even begin to think about doing the things he's doing, and it's only training. It's really something epic.
Just like to say, like, the training is the hard part. I didn't ride a bike before this. I hadn't ridden a bike in many, many years. I'm not the best swimmer, and I hadn't ran before my back surgery.
Which he had done in the Walton, by the way.
So you've had surgery as well, Liam?
Yes. Yeah, I had 3 ruptured discs in my spine, and I was in 23
October 21. You were in
2021 to have.
So how much are you hoping to raise then?
I would love to raise. Well, my target is £5,000. I'd really love to knock that out of the water. I really would. I really, really would. We've had so many donations already, and I'm only training just now, so I'm hopefully it'll get some traction, and we can as much as we can. Just like to say that I hope that no one ever has to stay in the home from home, because if you're staying there, it's not a very good time for loved ones or families, but you'll be so grateful that it's there if you need it. When I said before it was a lifeline, it genuinely was, and you meet other families in there that are going through the same time as you. You can go into the communion room, there's food that's left in the fridges, there's coffee, there's tea. If you just need that little 5 minutes, everybody knows they're there for not the very best of reasons. It is an amazing place, and you would be so grateful that it's there. I am super grateful. This is why I'm doing what I'm doing.
I actually went to the home from home, so they invited me in so I could see where Liam had stayed. Everything has been thought of. It is fantastic. It really is.
Thanks for listening to Neuro Stories. You can listen to more episodes on Spotify and Apple Podcasts, and you can stay up to date with the latest news and events from the hospital on our social media channels, at the Walton Centre on Facebook and Instagram, and at Walton Centre on X. If you've got any feedback, email the communications team at wcft.communications@nhs.net. This podcast was recorded, edited and hosted by Sam Fleet from the Walton Centre's communications team.